Okay, so here's where we left off with the stages of tooth decay, and this picture is in your book on page 710. You're not going to be tested on this actual picture, you're not going to be labeling it or anything like that, but I think it's important to understand the stages of what's going on with tooth decay, as well as, a lot of people. Well, I don't know about a lot of people, but I will say that this class is a required course for the dental hygiene program. So we usually have a few people in class who are interested in dental hygiene. So it's good to talk about this stuff. So we have the different parts of the tooth. So you have the enamel, the dentin, the pulp, and then the root. Okay. So then you get the little tiny plaque forming. Okay, so that's what these little green dots are. That's the plaque, and that's like the little small collections of bacteria that are kind of growing. And then as the bacteria feeds off of the leftover food, you end up getting decay, and then of course decay is what a dental carie is, often called a cavity. So then if you let that go and you continue to do nothing about it, it just grows and grows. So you can see that the decay now has almost completely gone through all of the enamel. Then the next stage is when the decay starts to occur in the dentin. And then the final stage is when the decay ends up in the pulp. And oftentimes, if it's gotten so bad that it's at this point, a lot of times the person will end up having to get a root canal. And if it's super, super bad, they may even have to get the tooth removed. But certainly at that last stage of tooth decay, when the decay has reached the pulp, oftentimes that's what they have to do with the tooth in order to save any of its integrity. Okay, there we go. So then the gums, obviously the gums are the tissue that anchor the teeth there. The term for inflammation, well, I should start out by saying the technical term for the gums is called the gingiva. So when the gums are inflamed, it's called gingivitis. Gingivitis is characterized by bleeding of the gums, such as when you brush your teeth. So if you brush your teeth and when you spit it out, if you see a lot of blood, that can be an indicator of gingivitis. Gingivitis can be caused by different types of streptococci, strep pyogenes, of course, being one of the major culprits, as well as actinomycetes and other types of gram-negative bacteria. The continuation of gingivitis is called periodontitis or periodontal disease. This is when the inflammation has gotten so bad that pockets of pus will actually form in the gums. And the tooth or multiple teeth will actually just fall out because the inflammation and the degradation of the gums has gotten so bad that there's now nothing to really anchor the tooth, and the tooth just falls out. So here's the stages of periodontitis, which is on page 711. So again, we're talking now about the gums, not the teeth. So you can see that when the plaque forms way down here, okay, again, the same type of thing is going to happen, and then you get this formation of periodontal pockets, and then you have kind of the advanced periodontitis where the gums are so inflamed and they're so broken down that there's really nothing left to hold on to the teeth. This is, of course, why flossing is important, because when you brush your teeth, you get kind of all the surface of the tooth, but you don't get deep down between the gum and the tooth itself, and that's why flossing is important, because it helps you to remove any of that leftover food that the bacteria may be feeding off of. All right, so that's enough about the dentist, I guess. We're gonna move on down the line here. We're gonna move to the rest of the digestive system. So, like I said before, lots of things are killed in the stomach acid. Okay, there are some microorganisms that are able to resist that acidic environment in the stomach. And then there's also organisms that will actually escape into the bloodstream and then get back into the intestine. So they kind of like, from the throat or the esophagus, they'll just kind of like jump into the bloodstream and then make their way into the intestines. And therefore they bypass the stomach and they don't get killed by the stomach acid. So another thing that is super, super important, I've mentioned this before, and we kind of, we talked about it, and then we just kind of like left it kind of go. This is super important when we talk about diseases of the digestive system, okay? An infection versus an intoxication, all right? So most of the diseases that we've talked about have been diseases caused by the actual organisms, okay? But there are diseases that are caused by a toxin that the organism produces. Great examples that we've talked about before have been tetanus and botulism, okay? So tetanus and botulism, it's not necessarily the organism that's the problem. It's the toxin that they produce, right? So the tetanus toxin, the botulism toxin, those toxins, which are exotoxins, okay, which we talked about exotoxins, that's what actually can hurt you, that's what can make you sick, and that's what can kill you, okay? So a lot of these digestive system diseases are technically intoxications because what can happen is the organism itself may be killed by the stomach acid. It may be, maybe it needs oxygen, so it doesn't get enough oxygen in the intestine and it gets killed. But the toxin, the chemical that it produces, that's not affected by the stomach acid. It's not affected by the lack of oxygen. And so, you still get sick. So maybe your stomach acid killed the organism, but the toxin remains, and so you still get sick. So the most common, and I put GI here, GI stands for gastrointestinal, which means the stomach and the intestines, okay? So gastrointestinal diseases are almost always accompanied by diarrhea, okay? So it's essentially the most common symptom of an infection of the digestive system is diarrhea. Failure of the large intestine to reabsorb water. So the large intestine's main job is to reabsorb water from the chyme. The chyme is the remaining material after all your food has been digested and after all of your nutrients are absorbed. You have kind of like this leftover stuff. Maybe there's a little bit of vitamins and minerals left, but it's mostly water and waste, okay? So when it all gets to your large intestine is supposed to reabsorb most of that water so that when your feces come out, they're mostly solid. So the only thing that should be in your feces is going to be bacteria and waste materials, and really that's it. So diarrhea can be caused by an infection or an intoxication, okay? And the term for very severe diarrhea is dysentery. So we're going to talk about several different diseases that cause dysentery. And again, dysentery is just really, really bad, severe diarrhea, diarrhea that's so bad you can actually die from it, okay? The reason that diarrhea is so dangerous is because of dehydration. Your body depends on the large intestine to reabsorb a lot of that water. If you're losing a lot of water because of diarrhea, you need to be ingesting a lot of water. The other problem with a lot of digestive system diseases is you can actually get the disease from infected water. So you may be drinking water that's infected with a bacteria. That's causing you to have diarrhea, which is causing you to become dehydrated, which means you're going to want more water. But if you drink more of that contaminated water, your symptoms are only going to get worse and worse and worse. So that's an example of how the fecal-oral cycle, how it actually works in order to, make you sick. And then other GI symptoms would be cramping, nausea, vomiting. Lots of these diseases will also cause vomiting, but diarrhea is the major symptom. And then if it's really, really bad to the point to where it can actually cause death, that would be called dysentery. Gastroenteritis is the term for inflammation of the stomach and intestines. There's another term called gastritis. Gastritis is inflammation of just the stomach. That's usually not due to an infection. That's usually due to either eating too much food, drinking too much alcohol, or like something like too much spicy food, or eating something that you're allergic to. That can cause gastritis, which is different than gastroenteritis. Okay, so the first organism we're going to talk about is Staph aureus, or we can say staphylococcal enterotoxicosis. Okay, that is the technical term for the most common type of food poisoning. So I'm sure you've all heard of food poisoning before. Maybe some of you have even suffered with it. I would say probably in my life, I think I've had it once. It is kind of hard to prove unless you actually get tested for all these different things. Usually with food poisoning, it usually lasts about 24 hours. You're just kind of like stuck at home, mostly stuck in the bathroom. It's usually really bad diarrhea, really bad vomiting. Your body kind of gets rid of all the bad stuff. You feel terrible for 24 hours, and then usually you can bounce back. You just make sure you stay hydrated. Get some good food, not, poisoned food, and you're good. But the most common type of food poisoning is from staphylococcal bacteria, and it's usually some strain or some version of Staph aureus. Just to give you a little number here, it takes about 1 million bacteria per gram of food to make someone sick. That's why you want to make sure your food is, obtained properly, it's cooked properly, it's refrigerated properly. We talked about this when we talked about, things like the danger zone and leaving food out at room temperature. We talked about how important it is to cook food properly, refrigerate it properly, freeze it properly, and make sure that you're, doing all those things. It's very important. By the way, 1 million bacteria per gram, that's not a lot. Okay, remember, bacteria are very, very tiny. So I want to make sure you understand that statistic means that it takes very, very little bacteria per gram of food to make you sick and give you, those symptoms of food poisoning. Now, something that is much, much worse than, typical staphylococcal food poisoning is shigellosis. Shigellosis is from a bacteria called Shigella, and it causes bacterial dysentery. So again, dysentery is severe diarrhea that's bad enough to actually kill you. There's 4 major species of Shigella. They produce different types of toxins that will cause this severe, severe diarrhea. The worst toxin is actually named for the bacteria. It's called Shiga toxin. Shiga toxin can actually be very deadly due to the severe diarrhea that it causes, and the toxin also has the ability to kill macrophages. So not only is it making you severely sick, it's also damaging your immune system. So you can imagine, really, really bad stuff there. Okay, I think we have enough time for the next topic. So it's something that you all heard of, which is salmonella. So salmonellosis is gastroenteritis caused by species of salmonella. So many animals have salmonella that live inside of our digestive tract, and salmonella is considered to be potentially pathogenic at all times. So it is potentially dangerous to everyone, but mostly we're talking about infants and the elderly. So it lives inside of you. It normally does not cause any problems. It doesn't give you any issues, but sometimes it just mutates and it decides to make you sick. All right, we're just about out of time, so we will pick up with more salmonella in the next video.